record this. If you need it, you can take it.
Yeah,
Okay.
yeah, okay, thank you. All right, okay. Thank you
Yes,
so much for meeting with me. This is like very, very like thoughtful.
absolutely. I'm happy to meet with you and I'm happy to go over any questions that you have. Yeah.
Okay.
Yep, absolutely.
Okay, so I don't want to just like right on like jump in. So could you tell me a little bit about yourself and what you
Yes.
do?
Yeah, I sure can. So my name is Stacia Scott, and I'm actually a born and raised resident of Carmel. So we live in
Hmm.
Carmel. I am a nurse practitioner and I own a postpartum clinic. It's actually the only postpartum clinic in the entire country.
Oh wow.
Yes. And so we treat moms in all 50 states virtually.
Hmm.
But I'm a mom myself, which is how I kind of came up with this concept. So I have a 5-year-old, a 4-year-old, and a 2-year-old. They're all little boys. And then I married my high school sweetheart, Eric, and we
Um,
both went to Carmel High School. And
oh, that's nice.
after my first, I just saw such a lack of care in the postpartum space,
Hmm.
particularly in regards to just like follow up and you get one 6-week visit as opposed to being seen all throughout your pregnancy. And there's really nothing that was taught to me for
Hmm.
postpartum when I was pregnant. And so I just thought postpartum was just a period of time that was short, that you would just get over things. And I was hit with everything. I had anxiety
Um,
and depression and thyroid issues and hormone issues and I knew that something was off, but everyone just kind of kept telling me that I was just anxious and depressed. And I thought, but I'm having like physical symptoms, like I can feel things. And so
mhm.
it ended up being my thyroid. My thyroid was really out of whack and no one tested it. So which is standard. We don't get any labs postpartum. And so I just felt
Mhm.
like there was such a lack of care and I just decided to do something about it. So
Okay.
that's kind of what happened. And then Postpartum Care USA was born.
That's nice. That's very, very nice. Like, I, sorry, this is just like unbelievable to me right now because I'm so, so grateful that you decided to talk to me. Because like, I've been like looking for so many people. Like, I've been looking for so many different nurses and doctors to shadow, and I still am like waiting for them to like reply back to me. And like,
Yes.
you're the only one who reached out and actually decided to do this with me. So thank you so
Oh
much.
my gosh, you're so welcome. And I can help with that too. We can chat.
Okay.
And I can help with that. I have a lot of nurse friends. So
Okay.
yeah, so I can help with
Yeah,
that.
that would be great. Okay. All
Sure.
right. So, I have a couple of questions
Sure.
that I have for my project. So, is it okay if we can go ahead and start with them?
Absolutely. Ask away
Okay. All right. So, the first question is, how often do you see cases of postpartum depression in your practice?
every day. Every single day. We see patients that have postpartum depression, postpartum anxiety, but then there's other factors too. So there's postpartum rage, intrusive
Mm-hmm.
thoughts, which means that they're thinking things that they don't want to act on, but it freaks them out, right? Like something
Oh,
happening to
okay.
their baby, like something simple as like they look before they go down the stairs and they see themselves falling down the stairs while holding their baby. But it's
Mm.
things that aren't likely to happen, right?
Okay, okay.
There's postpartum psychosis.
Mm-hmm.
So we have rage, there's postpartum OCD. So
Mm-hmm.
moms that really struggle with having to have everything in order and they become obsessed with like cleanliness and germs and that type of stuff. So we have rage, OCD, intrusive thoughts, psychosis, anxiety, and depression.
Mm-hmm. Yeah.
Yep.
Okay. Um, So, what screening tools do you typically use to assess postpartum depression? Like, I know you were talking about how there's not many, especially with your issue with thyroid. And how effective are they in identifying how high risk a mother is for postpartum depression?
Yes. So I can actually send you our anxiety and depression screening form. So
Okay.
there's really one that's called like the PHQ-9 and then the
Mm-hmm.
GAD-7. So there's technically two, but that's for generalized anxiety and depression. So
Okay.
that's what's used in the hospitals where when we think about postpartum, it's a completely different area, right?
Mm-hmm.
But what the United States does in our healthcare system is they treat it all under one umbrella which isn't correct because there's so many things that goes into postpartum anxiety and depression. Like it
Yeah.
could be their
Hmm.
thyroid, right?
Yeah.
It could be past trauma. It could be nutrient deficiencies. So we have our own anxiety and depression screening form, and we can see if they're having anxiety, depression, rage, OCD, intrusive thoughts, and psychosis. So
Okay.
it's our own, and I can send it to you. I can
Okay. All right.
up
Thank
so
you.
you can have
Okay. Yeah.
it. Yeah. Yeah. And
Okay.
the score is out of 30. So
Hmm.
at the bottom here, I can actually let me pull one up for you so you can see what
Okay.
I'm
All
talking
right.
about.
Thank you.
You can kind of check. Let's see here. Okay, let me go into my forms, intake forms, and preview. Okay. So all of our patients get this and they get it at least 2 times a month. So in the generalized world, you get it 1 time and that's it. So it's one
Oh,
and done. Whereas
okay.
postpartum can go up and down and sideways for a
Hmm.
long time. So to get one anxiety and screening form, anxiety and depression screening form 1 time at 6 weeks is kind of crazy. Um,
Hmm.
so let me show you right here. Okay. So can you see my screen okay?
Yeah. Yeah, I
Okay,
can.
so this is our own. So we came up with this. So as you can see, there's some that are pretty standard, right? But
Hmm.
as you go down, there's more things that happen, throughout postpartum. So like having scary or panic thoughts, having hallucinations, the thoughts of harm. And then we can also talk about there's a rage one. Like, are you overly concerned and focused on things being done a certain way that's interfering with others helping you? That's OCD.
Hmm.
Having racing thoughts at night that interfere with their sleep, that's anxiety or insomnia. Others
Hmm.
mentioning that they're worried about me. If you enjoy things prior to delivery, prior to having your baby, that's depression. Having trouble keeping up with daily activities, that can be depression and anxiety. Um, and so we can see, and like are things making you angry randomly throughout the day? That's rage. So we can see and we say at the bottom, they add up their score. And if they're 0 to 10, that's common. That's a common range, minimal
Hmm.
concern. And then if it's 11 to 22, that's elevated, will benefit from additional support. And then if they score over a 23, that's severe. So they
Okay.
need to reach out to my nurse immediately to be seen. And then we have a protocol that if they score over a 23, that they need to be monitored for at least 6 months in our clinic.
Okay.
Yep. Yep.
Wow.
That is,
That
yeah.
that is a lot better than so many screening tests I've seen. Like, it's very nice.
Thank you.
Okay, next question. At what point after childbirth do most women start showing signs of postpartum depression, and what have you seen based on that?
Yeah. So have you heard of postpartum blues?
Yes.
Okay, so postpartum blues is pretty common.
Hmm.
Doesn't normal, but it's common. So typically that's within the first 2 weeks of delivery. And what we see is that's just a huge hormone shift where moms might feel sad. They might be like all of a sudden they're like sitting there and then they just start crying and they're like, I don't know why I'm crying. It's just kind of them getting through their day. And so what happens is postpartum anxiety and depression is if that does not go away. Okay.
Hmm.
And then it
Yeah.
turns into other things and then other things. So typically, the standard time that we see it rear its ugly head, where it's like, oh my gosh, something's going on, is between 4 and 6 months postpartum.
Okay. All
Mhm.
right.
Yep. So, and we always say if it's affecting your daily life, like you're not able to shower, or you just feel like laying around all day, or you don't like getting out of the house, like something else is going on, and it will
Hmm.
get worse. So we want to jump on it. Hmm.
So, based on that, is it possible for then postpartum depression to turn into anything like postpartum psychosis or OCD? Or okay, or like do you think they're also their like own separate categories? Like someone could just have OCD but then not have depression?
Yes, you're exactly right.
Okay,
They
all
absolutely
right,
can.
okay.
Most of the time, they have a couple, but they don't have them every
Hmm.
day. Like it kind of can ebb and flow with whatever
Hmm.
happens. So a lot of moms experience rage, and it might not be every day. It might be when they're home or their husband's out of town or their significant other isn't home to help them. And then like consecutive days go by and then all of a sudden they're so overstimulated with noise and they're touched out and then they just like explode. So that would be
Mm,
rage. But yeah, it doesn't have to be just one or it could be a combination. Most of my moms that we see have at least two, if not more, but it
mhm,
doesn't, they're all different.
mm.
Yep.
Okay.
So you can have one, you can have all of them. I had all of them. So
Mm.
after my first, yes.
That I can't even imagine. What did you do did you seek treatment? Did you go somewhere?
Yeah. So what happened with me is the thing of it is that again, because postpartum anxiety and depression is treated like generalized anxiety and depression, my only two options was medication and therapy. But
Mm,
I knew something deeper was going on. And I was like, but how do you know it's not my thyroid? Or how do you know it's not that my hormones are so out of whack or that I'm not eating well? A lot of new moms do not eat well because they're so tired that
mhm,
when they have to choose between sleeping and eating during the day, they're going to sleep, right?
yeah.
Well, when you think about nutrients, nutrients balance our hormones and hormones balance our mood. So if we're not eating and nourishing our body, then that's when we see significant mood disorders. So what we did is I found one of my girlfriends is a nurse practitioner as well, and
Mhm,
she actually works with me in the clinic. And we decided to come up with a lab protocol. So we look at inflammation labs, we look at metabolic labs, we look at nutrients, and we look at thyroid. And
mhm.
she did labs on me and my thyroid. I had postpartum thyroiditis that turned into Hashimoto's. I had no nutrients
Oh.
at all. My nutrients were
Mhm.
completely depleted. So we replenished my nutrients and we fixed my thyroid and all of my mood stuff went away.
Wow.
Yep. So
That
that's
that
what we do
is
in our clinic. Yeah, we have
wow.
never had to prescribe a single antidepressant or anxiety med in our clinic.
Oh wow. So do you only like focus on nutrient, sleep, and like factors like that? Like the little things
The
basically.
little things, you're exactly right. It's the little things that add up, the basics, right? How are you eating? How are you
Mm-hmm.
sleeping? How are you moving your body? And how are you handling stress? And everyone's circumstance is different, right? Everyone's
Mm-hmm.
environment is different. How people eat their food, when, what, how they eat, their access to food,
Mm-hmm.
what's different stressors in your life. Like your stressors is probably school, right?
Yeah.
Whereas my stressors is running a business and being a mom and a wife and a friend and keeping everything, you know what I mean? And
Hmm.
luckily,
Yeah, it's so much different. Yeah.
it is.
Hmm.
And
I
so, but
completely
everyone's
understand.
different. So what Ananya's body is going through and what her symptoms are not going to be mine. You know what I mean? And
Mm.
that's the same for
Yes.
every patient. So every single one of our moms has a different plan because their labs are not the same. How they eat isn't the same, how they move their body and how they handle stress. So our job is to get them to a state where their body feels safe and they have a really good
Hmm.
rhythm. And then it just kind of takes off from there.
I am super impressed and happy.
Thank you.
Okay. Okay. Are there any differences in the severity or timing of postpartum depression depending on whether the mother had other mental health issues? So, like, if she had an existing mental health issue, did something happen for it to build upon, and how does that affect PPD?
Sure. Yeah, that's a great question. So, a lot of times when we see moms that have prior mental health issues, it's really like they had past trauma.
Hmm.
They went through a bad breakup or a divorce or something in their 20s, or they were abused. So that does play a factor. But what we see is if moms that don't have that and then they get it postpartum, it could be multiple things. It could be that they had a traumatic birth.
Hmm.
Moms that have traumatic births, where their birth plan just doesn't go as they thought it was, or have like emergent C-sections or something like that, we tend to see more anxiety and depression that way. Also, our infertility moms, moms that go through
Hmm.
IVF and fertility,
Hmm.
they tend to have more issues mentally postpartum because they're inflamed. Because think about it, when you're pumped full of hormones for a long time to try to have a baby, and then all those hormones go away, that can cause significant inflammation. So,
Yeah, that's
so
true.
yeah, so it just depends. Hmm.
Hmm. Also, on that topic, what do you see based on moms that aren't able to lactate? Is there any like relation between lactation and postpartum depression, and what
Yes.
is it?
Yes. So typically when we see moms that aren't able to lactate, a couple of things I that immediately come to mind is how was their delivery, right? Was it on time? Was their body forced into a delivery like like an emergent induction? Was their body ready? An
Hmm.
emergency section, that type of stuff. And then the second thing I think of is nutrients and inflammation. When your body is lacking nutrients and your body is super inflamed, your body goes into what's called a fight or flight mode. So essentially,
Hmm.
your body doesn't care about about producing breast milk. It just doesn't. Your body wants to just survive. So its only job is to have your heartbeat and your lungs to fill up with air. So I always say, like, if you are nutrient depleted, your breast milk is going to have a heck of a time coming in, or if you have a traumatic delivery. Those are typically the two that we see.
Okay.
Yep.
Okay. Have you seen any trends or any sort of relations where PPD is most common or prevalent in women with a of family history of depression or anxiety? So it runs in their family.
No, I don't.
Oh,
I know,
okay.
I do not. This is why. So remember, everyone's body is different.
Hmm.
So it would be like saying anxiety and depression is not genetic. Okay. So
Yeah.
it's very circumstantial, but we also want to take a look inside their body, right?
Hmm.
So say if I have a patient, and it also depends on like their childhood, their upbringing, what their support system was, what they've been through as just a child and adolescence and through college. I have had a lot of moms that have had significant trauma. And so for that, yes, they are more at risk because trauma comes out postpartum. It just
Hmm.
does. No matter what. I remember one of my patients was like, I grew up in a household. It was wonderful, but I always knew my parents always fought about money in front of me. This is just
Hmm.
a simple example. And she goes, and I never thought about it. My husband and I had a baby, and then all of a sudden I was obsessed with money. Like, do we have enough money in our account to care for this child? Like, are we good? Da, da, da. It's little things like that. So trauma
Hmm.
can come out postpartum, but no, we do not typically see that if your family has it or if like your mom went through it, that then the daughter is going to have it.
Hmm.
Because
Yeah.
everything
Hmm.
depends on their delivery, how their nutrients
Hmm.
are, how their body reacts to postpartum, which is all across the board. That's a great
So
question.
it's more based on your environment and
Yep.
what social factors influence that.
Circumstantial, very much
Okay.
so. Very
All
much.
right. Okay.
Yeah.
Because
Whereas general anxiety and depression is more like serotonin, dopamine, that type of stuff.
exactly.
Really
Yeah.
not this.
Hmm.
Common misconception.
Um, yeah, I was also asking genetically because there's just been like I've actually read a lot of research on
Yeah.
how like there's a specific type of gene that you inherit from your parents and that can make you more susceptible to having depression or anxiety. So I was just wondering if that was related to why some people might get postpartum depression. And it honestly might be a little like in the genetic side, but of course you
Yeah.
look at like situational factors and like
Yes.
circumstantial factors, so
Yes.
I completely understand.
Yeah,
Okay.
and that can be the two things can exist in the same space, right? Like
Obviously, yeah.
we might have cancer in our gene history, but that doesn't mean I'm going to get cancer. Do you know what I'm saying?
True.
But
Yeah, I do.
if I'm not taking care of my body and I'm smoking cigarettes and drinking every day, then I'm going to put myself more at risk to get cancer. So it's
Yeah.
kind of the same factor. Yeah. We all have
Okay.
genes, but 90% of all diseases, illnesses, mental health is environmental and it is
Very
controllable.
true. Very
Yep.
true. Very
Yep.
true. Okay. Okay, so if we talk about hormones, do
Yeah.
you have any sort of protocol in place to monitor hormone levels of the patients that you deal with, to either diagnose, predict, or manage postpartum
Yep.
depression?
Yes, that's a great question. So I'm going to explain this in like a fun little way.
Okay.
So you have big hormones and you have small hormones. So our big hormones are like cortisol, our stress hormone, and thyroid. Okay. Those two
Mm-hmm.
are big. Our small hormones are progesterone, estrogen, testosterone, melatonin, which is like our sleeping one, that regulates our sleep. If our big hormones are not regulated, our small hormones will never be able to be regulated ever.
Okay.
And so we really, really concentrate on cortisol and thyroid because if those are
Mm-hmm.
regulated, the other ones regulate automatically.
Okay. I've also heard with postpartum depression, there's also progesterone, estrogen, and I think there's not much of like testosterone, but I know it's a lot of estrogen and
Yep.
progesterone. So
Yep.
what do you see with those two? Are those the big hormones? And then
So
that's
estrogen and progesterone are small hormones, okay?
okay.
Because your big hormones, they're the ones that control your small hormones. So, for
Mm-hmm.
example, if your cortisol is super high, your estrogen and your progesterone will never be able to be balanced
Mm-hmm.
because your cortisol will trump it every time. So, we always really concentrate on that. And progesterone is our calming factor,
Mm-hmm.
that's our calming hormone. And so, yes, you're correct. So, usually when we see like really high anxiety, low libido is also another one.
Mm-hmm.
I know that their sex hormones are all out of whack, like their estrogen,
Yeah.
progesterone.
Mm-hmm.
If we see panic attacks, that means that their progesterone is out of whack, and 9 times out of 10, their thyroid and their cortisol is off.
Mm-hmm.
So we don't really need to test their small hormones because if their big hormones are off, then their small hormones are going to be off no matter
Mm-hmm.
what. You know what I mean?
Yeah.
So, but
Yeah.
we do see high estrogen dominance and low
Mm-hmm.
progesterone in a lot of patients. And that also they'll tell us that they have like PCOS or
Mm-hmm.
endometriosis or something going on that
Mm-hmm.
low libido, panic attacks, all of that stuff. So we know, but you have to balance your big hormones for your body to feel safe. And then your small hormones will just automatically like go back to normal levels.
Mm-hmm. Cortisol is in charge of so many things. Like cortisol
Oh,
now, it's such a
especially postpartum. Holy
hmm
cow. It controls everything and it trumps
yeah.
everything. So if
It
your
really
body
does,
doesn't
yeah.
feel safe, then that's
hmm
cortisol is one of the biggest things that we deal with in the
Definitely.
Mhm.
Not only like postpartum, but like even with like high levels of cortisol can stop your organs from functioning. It's so major. It's
You're right. It
crazy.
causes gut issues, it causes
hmm
OCD, rage, hormone instability, weight gain. I mean,
hmm
it goes on and on.
It
Insomnia.
does.
Yeah.
hmm Um, Okay, have you ever had any sort of patient that comes from a very like not so well area and that's why they're not able to get access to a lot of the things that they need access to deal with postpartum depression? And if so, how do you manage that? How do you help them in that way? And what do you see about like in terms of like if you talk about like I'm sure you're aware of the social determinants of health and like how low socioeconomic status can like relate to postpartum depression and how that influences women. What do you see based off of it in your
Sure.
clinic?
Sure. You know, it's I think a lot of it has to do with how our healthcare system is just set up in general, right?
Mm-hmm.
So our maternal mental health is going backwards.
Yeah.
For example, when moms used to have C-sections, right? Like back in
Mm-hmm.
the day, the minimum stay was 3 to 5 days. 3 to 5 days, which is so great because a lot can happen. You're more at risk for things happening between day 1 and 17 when you have the second biggest abdominal surgery in the world. Now, moms are sometimes like shoved out the door within 18 hours of having a huge abdominal surgery. And so I think that it really is where our healthcare system is at. It's turned into a profit instead of looking at patients and what they deserve and what they truly
100%.
need. So, insurance, for example, insurance, like I have a very love-hate relationship. I think it's wonderful for like emergent situations or cancer patients or like chronic diseases. However, when it comes to true like individualized care, insurance doesn't approve patients on what they need. They're approved
Mm-hmm.
based on what's approved. So,
Mm-hmm.
and that's really sad because
Yeah.
there's so much that can be done. So, in regards to like socioeconomic statuses, I have a lot of stay-at-home moms, a lot who have like their husbands work on the railroad or their husbands are farmers or they work for a church or something like that. So they're not
Mhm.
super well off, but I also think it's their attitude. I think your attitude
Mm,
can really determine like how your postpartum goes. Like if you are If you have like a good support system, and for the most part, a lot of my moms do, but I do see that there is a significant need for postpartum care in those other areas that have like low socioeconomic statuses, for sure. And
Definitely.
I honestly think that it all comes down to education. Like if they just knew how to rest, what to eat, how to handle stress as a mom, that alone would do wonders. So I really think it's just lack of education, time.
Hmm.
I think that a lot of our providers don't have a ton of time because the hospital system is a business. And so
Hmm.
it's not about the patient anymore. It's about how many patients can be seen in a day, right?
Hmm.
So there's no
Yeah.
time. I mean, for example, postpartum, our visit at 6 weeks is 15 minutes. 15 minutes. That's it. And then
Yeah.
we're out the door. So,
Hmm.
that's a really multifaceted question. I hope I answered that. But yeah, we
Yeah,
need a
no,
lot
you
more
definitely
education.
did.
Mhm.
Yeah,
Need a lot more
definitely.
education.
Yeah, because like even with like physicians in general, like there's so much like physician burnout going around too because
Oh, mhm.
it's just like they themselves are so tired of the fact that they only get to meet with their patients for like what, 7 minutes,
Yeah.
10 minutes,
And
and that's it because then they have to be out the door and go to the next patient. It's honestly crazy. The healthcare system, especially also in my class, we've talked about every single thing wrong with the healthcare system, and it's really opened my eyes. And I'm like, do I want to go in? Like, I do. I want to make a difference, but then I also need to think of like my mental well-being, my standing. There's just like so much.
well, and here's the thing. So we cannot accept insurance. So my clinic, we
Oh,
cannot accept insurance because postpartum is not insurable past that 1 6 week visit.
oh,
Hmm. Yeah. So
so,
we're cash only.
oh,
Yeah.
so what are your price ranges for whatever
So
sort
it
of
depends.
treatment?
So we have financing available. So a
Mm-hmm.
lot of moms go through that. So some moms get it as low as $40 a month. And so yeah, but labs are super expensive because we do root cause integrative labs. So it's not just like
Mm-hmm.
a PCP can just order it because insurance won't cover it. Um,
Mm-hmm.
and so our price ranges, it ranges from $40 a month to $500 a month. It just depends on what their need is. And then we look at their anxiety and depression screening form and then they fill out a whole intake form. So it really just depends on where they're at. Hmm.
Okay.
But we have a registered dietitian, we have nurses, we
Mm-hmm.
have 5 nurse practitioners on our team. So yeah, it just depends. But yes, we cannot take insurance because there's no protocol for postpartum in the United States. Hmm. Really sad.
Yeah, no, it is definitely. So did you do any, this is not related to my research, but I just want to get to know you if that.
Yeah, go
So,
ahead.
did you do like anything before you started this business? Like, did you work
Yeah,
anywhere?
I did. Yep. I worked internal medicine at Riverview. So
Oh,
COVID, and a little bit
mm-hmm.
after COVID. So I was internal medicine. I also, my primary background is oncology and breast cancer.
Oh,
Mhm.
oh, wow.
So that's my primary background, which is great because I see women all the time. So I got really, really, really good with hormones and like hormone instability and stuff like that, which plays a major role in postpartum. But
Mm-hmm.
really, after my first son was born and I had every single symptom, and the only thing they offered me was anxiety and depression meds, birth control, and therapy, I was like,
Mm-hmm.
what? And so I studied literally every single book I could. I'm a perpetual
Wow.
learner anyways. And then
Mm-hmm.
I had this idea to open up a clinic. And then I just decided to jump 2 feet in and start slowly. And then here we are 2.5 years later, and we've treated over
Wow.
4,000 women across the country. So yeah, so we're starting to make headway. The biggest issue I feel like we face is changing the narrative that postpartum symptoms are normal because they're not.
Mm-hmm.
So we're trying to
Mm-hmm.
change that narrative of, hey, you can actually be proactive and prevent these things from happening. So as they're not normal, they're common, right?
Mm-hmm.
And that's just where we're at in the United States. Because if you think about it, we rarely hear about postpartum issues overseas, right?
Yeah, that's very
It's
true.
because during their prenatal visits, they are taught how to eat and rest and how to handle stress and what to expect postpartum, and they get
Mhm.
labs done.
Yeah.
Here we
Hmm.
do not.
It's also a lot of like the cultural, I cannot pronounce that word. It's just a part of
Cultural.
the culture.
Yeah.
Cultural, yes, there
Yeah.
you go. It's a part of that. There's just like a lot of traditional values. Like I know in China, um like mothers are not allowed to go outside the house for like like this like particular time period, and they also eat super healthy.
Yep.
So I'm yeah.
And the community surrounds them. So you're thinking
Mm-hmm.
like the 5-5-5 rule. So it's 5 days in
Mm-hmm.
the bed, 5 days on the bed, 5 days around the bed. So the mom really just stays like in her area to heal and eat. And people bring her food, they
Mm-hmm.
help her with the baby. Like it's a communal thing. And that's how it used to be, like in the 60s and 70s.
Mm-hmm.
And then it just got into this quick, 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 quick. I mean, think about it. Everyone wants quick. So we want quick
Yeah.
recoveries. We want quick this, quick that. That's why we have DoorDash and Amazon and all of these things because we want quickness. Where really the postpartum period, you should slow down.
Mm-hmm.
We have this bounce back after baby. I just want to punch whoever came up with
Oh.
that in the face. And then moms are feeling all this pressure to
Mm-hmm.
get back to how they once were. And it's like, hold on a second. You just carried a baby for, you would never tell a pregnant mom, have that baby in a week. Like, no, it takes time to grow a
Exactly.
baby. It
Mm-hmm.
takes time to recover from postpartum. And so this, like, I have moms that struggle significantly because of social media with like influencers that are bouncing
Oh,
back and look amazing. And I'm like, listen, it's not real. It's
it's
not
not
fucking real.
definitely.
So, I mean, I didn't fit into my jeans until I was like almost 18 months postpartum with my third son.
Mm-hmm.
I'm 5'10" and weigh 140 pounds. So, it takes time and it's okay, right? But we have
Mm-hmm.
social media is really difficult for moms, the
Mm-hmm.
comparison. Hmm.
Definitely. Yeah.
Yep.
Um, there's like already so many questions that I already asked, so I'm looking for something new.
That's fine.
Okay, what do you think, what steps should the healthcare system take to improve the like understanding for healthcare? Like I know you talked about education and how it just takes simple education to make people aware about what they need to do, but how do you think the healthcare system could implement that?
Yes. So I think that providers need continued education in postpartum.
Mm-hmm.
I think providers need to be taught nutrition and supplements. I don't know if you are aware, but we get zero of that in med school or in
Oh,
any type of
no,
provider.
I'm
Yeah, we don't get
not
any
aware.
supplements, nutrition, education whatsoever. It's all psychology and pharmaceutical and all of that, which is super important. Don't get me wrong. But we
Mm-hmm.
really are really headstrong in that area. And really, we need to think about, okay, well, what are other things that we can do besides just throwing a pill at someone? I mean, I think like 70% of Americans are on at least one pill,
Mm-hmm.
one
Yeah.
pharmaceutical. So really diving into the supplements and nutrition and then understanding that labs are essential because
Mm-hmm.
labs are an inside view into every single individual, right? It's just like genetics. A lot of cancer treatments are all based on genetics. And so it's no longer all breast cancer patients get this treatment, all lung cancer patients get this treatment. No, it's based on the gene of the cancer and then the patient's genes. So really, it should be just that individualized. We have to get back to individualized care. We have to. And labs are one of the first things to do. But then there's that struggle with like the reference ranges of labs. So for
Mm-hmm.
example, with thyroid, just comes to mind immediately. We treat anyone that's over 1.85. Their TSH, their thyroid stimulating hormone,
Mm-hmm.
whereas a general provider, the reference range is normal up to 4.5.
Oh, oh,
So if you're at 4.5, you are super symptomatic already, right?
exactly.
So
Yeah.
more proactive approaches. So, understanding nutrients, understanding supplements, labs, and how you read labs. It needs to change.
Mm-hmm.
It just does.
Definitely.
There's things that we can see as providers to jump on things before it gets too
Mm-hmm.
out of hand. And our reference range values for our labs are very, 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 very high and long. I mean, it's like I'm like, how can we have a reference range of vitamin B is like 200 to 1,000? That's a huge
Mm-hmm.
range.
I know. I agree. I
So
agree.
yeah, so that needs to change. It probably
Mm-hmm.
won't, but it needs to. Yeah.
Yeah, it's gonna take a while, even if
Yeah.
it does,
We
but
need
it's okay.
proactive approaches, not reactive approaches.
Very true. Very true. Mm-hmm. Um, Okay, I know you talked a bit about this, and you said that most of your patients do have a good support system. But how often do you see some patients that don't have that and they have a lack of partner or family support? And how does that influence them? And how do you help to deal, like, how do you help them to deal with that?
I would say about 50% of our patients do not have a good support system, whether
Oh,
that be
wow.
they don't have family around them, whether that be they're in a really bad relationship. Um, so we really, I always tell them the two most important decisions you make in your life is who you spend your time with, who you spend your life with, and what you do for a job. Because
Mm-hmm.
if that is going to be your environment 24/7. So we say if you can't change your environment, then you need to change how you react to your environment. So we teach them like strategies, like how to regulate their nervous system, how to find reprieve, how to find rest, and
Mm-hmm.
strategies that they can change their behavior and how they react to their environment instead of if they can't change their environment, right? So,
True.
we really hone in like you're not responsible for the actions of XYZ, but how you
Mm-hmm.
react to them, you can be responsible for.
Mm-hmm.
So really honing in on that. And then once we get their mood kind of stabilized, they do understand that. And a lot of moms have, decided like, hey, we need to change our marriage. And they're able to talk to their significant other about that or their partner and say, this isn't going well for me. But when you're in a state of OCD and rage and your outbursts and you're up and down, like your significant other doesn't really know what they're going to get.
Yeah,
So
definitely.
yeah.
Mm,
So it's very multifaceted. But about 50% of our moms don't have a great support system. They don't have a lot of help, or they're in a bad relationship.
okay.
See that a lot.
Have you had any cases where any sort of verbal abuse, domestic violence, or any sort of that contributes to PPD?
Very much. Very much so. Yep.
That's
We
very
have
sad.
we have domestic abuse, we have verbal abuse, yes. And so we do have, it's called the Dad Survival Guide. And so because a lot of moms feel like their significant other doesn't understand postpartum, which is so true.
Mm-hmm.
A lot of
Yeah.
people don't. I mean, women don't even understand it, right? So how can we expect our partner to? So we do have that available for our moms, but yes, we about I would say 10 about 10% of our moms are in either verbal or emotional and or physical abusive relationships. Um, Probably about I would say about 10% is in like a physical abusive relationship and
Um,
about 20 to 30% is in like emotional and verbal. Hmm. Yeah. So we really have to, and there was a couple instances that I had to report because we do get those moms that are sexually abused by their significant others. So yeah, it's not always pretty. And of course
mm-hmm.
that's going to contribute, and we have to report that. Mhm.
Mm-hmm.
Yes, it's a sad
So
reality sometimes.
it very
Very
much is.
rare, but
So if that is going on, how do you like just because like I'm assuming that most of your like clinic is virtual. So are there cases where you do meet with your patients in person
yeah, if they're
or
local, I will meet with them. Yep,
okay.
if they're around Carmel or like, surrounding
Mm-hmm.
area, yes, I can meet with them in person. We'll meet for coffee and we'll chat and yeah,
Wow,
yeah, I can. But
that's
we have
sweet.
providers all over the country. So,
Mm-hmm.
one of my providers is in Tennessee. We have one in Bloomington.
Mm-hmm.
So we have providers all over. Hmm.
Okay. So if someone is going through that, I know it's like just like talking to them through a screen sucks so much because you're not physically there for them, especially when I'm pretty sure they are the type of patients that need the most like attention, the most care.
Yep.
So how do you deal with that? Like how do you make it happen to like make sure that they're getting everything that they need?
Yeah. So my nurse Amber, she is really good. We have patients that we reach out to every other day or
Mm-hmm.
weekly. It just depends on the extreme circumstance that they may be in. But we have check-ins, so if they need to be seen more, and then we give them that reality, like, hey, like if it's not going to be you, it's going to be your children. So you need to figure out like what you want. And we really try to empower them with like other options that they have. I'm never about divorce, that's
Mm-hmm.
not our, but something needs to change, right? Because
Definitely.
if it's not going to be her, it's going to be the children next.
Mm-hmm.
So, we really sometimes it's tough love, but we keep a very close eye. We do weekly anxiety and depression screening forms, and if we have to get the authorities involved, we do.
Okay.
I know that's kind of the
Um,
dark side of,
yeah.
but it's
Yeah, that's
very real.
true.
Yeah.
That yeah, yeah. Um, I think I've asked you mostly everything I had. But do you think that there are enough mental health resources for postpartum women? Oh, yeah.
Oh, it's unfortunate. I think that that is what I was kind of saying at the beginning. Like all mental health is put under one umbrella, right?
Mm-hmm.
All from adolescents to adults, like it's all postpartum, it's all put under this one umbrella, and it really needs to be separated because I had anxiety and depression in my mid 20s. I was like, what am I going to do with my life? All of that stuff. That is not postpartum anxiety and depression at all.
Mm-hmm.
And so that's what I kept telling my doctor. I was like, listen, this is not generalized anxiety. I've had that. I had that in my 20s. I feel like everyone kind of goes
Mm-hmm.
through that a little bit. I said, this feels different. It feels like I can feel it in my body. I kept saying, I feel inflamed. I feel depleted. I kept saying that. And no, no, that's not a thing. And I was like, well,
Oh,
I doubt it really is. It is a thing.
yeah,
Um,
that.
so yeah. So I really, really, really think that we need to change, our mental health. And the only option that these moms have who do feel like intrusive thoughts or psychosis is to go to behavioral health. And
Mm-hmm.
that's not going to help.
No.
They just throw, meds at them and then they send them on their way
Mm-hmm.
and then they feel sometimes even worse. So yeah,
Oh.
we've treated a lot. I would say at least out of our patients, probably 2 to 300 postpartum psychosis or moms that had tried to commit suicide. Hmm.
Oh.
Yeah, and they're doing wonderful.
Oh, that's great. That's good.
Yes, they're doing wonderful. Hmm. So
Uh,
a lot needs to change. Holy cow.
definitely, definitely. Yeah. It's the whole thing again that the healthcare system is just based on treatment and not like management. Like they don't know how to like manage diseases. They just think that like throwing meds at people and shoving like so many beds in their faces is just going to solve all the issues. But what they never look at like the little things,
Oh,
like you said, like that's what we've studied about in our class too. Like our teacher is so like against the healthcare system with this because he himself thinks that like exactly what you said, and
right.
he's been telling us all this, and it's just so eye-opening, like
Tell your
completely.
teacher that he is correct. Um,
Uh-huh.
Providers are also taught, remember, when they get out of med school, who is teaching them? Pharmaceutical reps. They
Mm-hmm.
heavily rely on pharmaceutical reps, right? I don't see any nutritionist or any like supplement company or anyone going in to say, hey, have you asked your patient how they handle stress? Have you asked them what, when, how are they eating, right? It's even something simple as moms don't chew their food because they feel so rushed. Like I know this sounds crazy, but
Mm-hmm.
moms are really good multitaskers, right? So a lot of times when they're eating, they're not sitting down, they're not like in a state of like zen. It's like the baby's screaming or they have a toddler on their leg and so they're trying to scarf down food. But when you scarf
Mm-hmm.
down food, you're not absorbing it.
True.
And we see a
Mm-hmm.
lot of nutrient deficiencies just based on how they eat their food, right? And it's little
Mm-hmm.
things. It's the little things, but no one wants to do it. And I'm like, give me every single mom because it's super simple. It's not super hard. So
Mm-hmm.
we really have to get back to the basics. Again, I will say it over and over. If people move their body every day, 90% of diseases would be eradicated. If we thought about what we are putting into our body, right?
Mm-hmm.
A lot of things would be eradicated or healed. If we find time to rest and how we rest and how we handle stress, all of that would be wonderful. But it has to be individualized because no
Mm-hmm.
one is the same person. So your teacher is correct. Or yeah.
Yeah. Okay. Yeah, I think that's everything. I
Okay.
asked that and so much more. So that's
Nice.
everything. Yeah.
Great. Okay. So what I'll do is I will send this video to you so you can either share it
Hmm.
with your class or you can send it to your teacher. So I have to do it through like a Google Drive because it's
Okay.
going to be long. So
Hmm.
if you cannot open it, let me know. It'll probably take about
Okay.
a half an hour to download, and then I'll
Okay.
send it to you and you can have
All
it.
right. Yeah. Yeah. Whenever is fine.
Yeah,
Yeah. All right.
okay. And then
Thank you so much.
let me know what other
Hmm.
areas that you want to shadow because I have a lot of nurse friends, so
Okay.
I can reach out. So you can just email me.
Okay.
Okay.
Yeah. I'll email you. Yeah.
All
All
right.
right.
All right. I'm so
Thank
thankful. Let me know if you need
you.
anything.
No, I'm so thankful. Like, thank you for this whole opportunity.
Of
This
course.
has
Of
helped me out
course.
so
Of
much.
course. Save my email and you have it. So if you need anything, you let me know.
All
All right.
right. Okay.
Tiffany.
Thank you.
Bye.
Bye. Have